Hi, language translation and services. The United States is indeed a melting pot. It's a meeting point for people from different cultures and languages. So it also applies in patient settings. These patients come from different continents, they have different languages, different cultures. So you as a nurse, especially if you are a foreign nurse, even if you are not a foreign nurse, you have to figure out a way to adapt, to be able to give your patients the best care even when there is a language barrier. So these different languages with patients who have limited English proficiency necessitates language translation and services. The law mandates hospitals and facilities to provide language services or language translation assistance so that patients or clients can get the best experience when they come into the hospital for one need or the other. Now, it goes without saying that these translations help with effective communication between the patient and the healthcare providers. And also, it's a form of safety because without it, some patients do not have access to informed consent. They have to be, whatever procedure, treatment that should be done to them has to be explained to them in a way they can understand. So with these language services, informed consent is possible for people with limited English proficiency. Then another thing is clear instructions. Their instructions are very important in the hospital settings, in that there are some things that ought to be done. There are some information that ought to be communicated to the patient, and it's very important that the patient understands so that they can adhere to those instructions. Then another thing is patient satisfaction. When you communicate with a patient in the way they understand, and they can get feedback, they know what you are saying, and they know what you are saying, all that helps to make their stay more satisfying. So it increases patient satisfaction. So that's another thing. Means through which these translations happen is, number one, medical interpreters. So there are people who are trained and certified medical interpreters. They interpret medical language, let me say that, between medical personnel and clients or patients. That's one. Another one is translated documents. So documents are translated to language of preference so that clients can get the best of their experience in the hospital. Another thing is digital translation. So this digital translation may be in form of an app in a phone, an app in an iPad. It may be in form of telephone services. So these apps could be video or audio. So many hospitals use the apps. Some of them are in phones, some of them are in iPads. The iPads can be mounted on a rack so that the patient, the nurse or doctor or whoever medical personnel is talking with the patient can communicate effectively. So the implications for nurses is that when you're speaking with when you're using the interpreter or the translator app, speak directly to the patient. Don't speak to the person or the voice on the app. Speak to the patient. and then the patient will listen to the interpreter and then answer you, so that your attention is on the patient. You are looking at the patient, you are assessing if the patient is understanding what is being said, and also you pick up on non-verbal cues while you are looking at the patient. Then another thing is, don't use family members or friends to interpret. I know it's very easy to do. You are like, they are right there, why can't they just interpret? The reason why they cannot interpret is because they are not medically trained interpreters. There is a medical language that is different from the everyday language that people use. So some things might be missing in the communication if you don't use medically trained, interpreters. Not only missing, but misunderstood, which is very, very dangerous. So don't use family members or friends. Rather use the medical interpreter provided by your facility. Some facilities use phones, some use iPads, some use telephone, the regular telephone. So use that rather than what you feel is accessible to you. Then document language preference in the patient's electronic health records. In fact, this one is when you're assessing the patient, the assessment templates for your patient, there is a place that will ask that, does the patient need an interpreter, yes or no? So there is where you will click. If your patient needs an interpreter, indicates that your patient needs an interpreter. Then also there are some interpreters in Google in the Google Translate and all that. Try to avoid those because they are like street language. They are not necessarily medically trained. So stick to what your facility provides. Then as a nurse, be culturally competent. That's one of the skills of a nurse, cultural competency. Be sensitive that people's cultures are different, and try to respect people's culture so that they can have the best experience, and also you will be able to give the best care. Thanks for listening. Make sure to like, share, subscribe, and follow for more.